What MUSC is to Charleston and the Lowcountry, Tidelands Health is to Georgetown and Horry counties. But taking these two medical powerhouses and joining them together will mean better access to cutting-edge care for South Carolinians. Joining us, Bruce Bailey, President and CEO for Tidelands Health, and Dr. Patrick Hawley, CEO for MUSC Health. Gentlemen, thank you so much for being with us.
Happy to be here.
So you two have been affiliated for some time now. How does this current expansion help patients? Let's start with you, Mr. Bailey.
Well, as you said, we've worked together for a long time, have a great relationship. A lot of our providers, physicians here at Tidelands Health trained at MUSC, so it's always been a very cordial and helpful and collegial relationship between the two organizations. How it's going to help going forward, you know, we're in a hotbed of relocation to South Carolina here in Horry County, Georgetown County, a lot of people moving here from elsewhere in the country. So we need to grow. We need to grow our services. We need to add new services, add new providers, new locations of care. So we really feel like a relationship with MUSC Health will help us accomplish all of that and accomplish it in a higher quality way and a faster way.
Absolutely. And Dr. Cawley, MUSC is growing by leaps and bounds. It seems like every day there's something new that patients here locally can take advantage of, including urgent care centers and you name it. So expanding your reach, what does this mean to the MUSC family?
Well, a couple things. First of all, Tidelands is our oldest partner and most robust partner that we've worked with for a number of years. And so working together is something natural for us. And this is all about taking it up another level. So we're pretty excited. We know we work well together and we know we can continue to deliver great services. The future is all about how different health systems and different physicians and nurses work together across a distance. And we think that by working closely with Tidelands, we can accomplish that.
And speaking of distance, it also sounds like what you're going to be providing is shortening that distance for patients. So if there is something that they need that MUSC can provide, does that mean that that's something that they don't necessarily have to leave Horry and Georgetown counties to get treated?
Yes. You know, the most important healthcare is local healthcare. People don't like to travel. People don't want to travel. They want to be near loved ones, particularly when they're sick. And we think that, you know, if done right and with the right partner, you can bring a lot of that care local. And so we think that Tidelands Health is the right partner in the Horry and Georgetown area, and we're looking forward to doing that.
Well, let me just tell you, I did an interview with someone completely not apropos to MUSC, but it came up that they moved here specifically because they wanted to be near a teaching hospital. So blending that with Tidelands Health, let's go back to you, Mr. Bailey. The fact that you are going to be able to include new physicians, new technologies, new clinical services to patients, what is that saying for the community of Georgetown and Horry counties?
Well, it's interesting that the interview you had of the person you spoke to talked about the academic medical center. That's one of the great benefits of this relationship. Is one of our challenges going forward will be finding enough providers, enough healthcare workers to meet the demand, and having a relationship with MUSC Health is going to help that. We worked with them a few years ago to start a family medicine residency program here. A tremendous benefit to Tidelands Health and our community. It will help us meet the need for doctors going forward. And one of the first priorities we'll have in working with MUSC Health is to expand the clinical teaching mission of MUSC Health to Tidelands Health, creating clinical rotations for allied health staff, medical students, and residents here at Tidelands Health. So a win-win for everybody, including the community, because we'll be able to bring high-quality clinicians, providers here to our community through our MUSC Health relationship.
Absolutely. Well, gentlemen, I want to thank you so much for joining us, and we're going to be excited to see in the weeks, months, and years to come how this expansion is going to grow and affect the community. Thank you so much for sharing with us today.
Thank you for having us.
Thanks for having us.
We're back in 2 minutes.